Hello, welcome back to the second part of this series of talks on nourishing a world of wellness through the rebalancing of emotional health. Well, in the first part of the talk, you will have heard me just talk about the possible need to look at the term etiology and the way in which we can maybe do that through a new spelling of the word and a new definition for it, and then to explore aspects of emotional health, what that meant, what that means, and just giving you some illustrations of that. And we were just coming on to look to explore some aspects of the research in connection with how we see neurochemicals that get released in the body being able to rebalance. And I mentioned the first one of these being the fact that there are receptors or docking stations for those signals that get the signaling chemicals that get released, and that those molecules then get removed from the system to help the system to rebalance. And I was going to do that by illustrating it through some research. And that research is into a molecule called CGRP. That stands for a neuropeptide called calcitonin gene-related peptide. It's known to be a very important multifunctional neurochemical, and it has various matching receptors, so docking stations present on many different types of cells across the body. It's also the most potent neurochemical to alter blood flow and pressure as well. Now, back in 1993, I happened to just finished doing my PhD on this very molecule, CGRP. And during that research work, I found it in traveling up and down the sciatic nerve. I did that through certain types of studies, staining studies, and also we know that it's available it can bind to those different cells across the body. And the research that I was exploring demonstrated that there were receptors for it on cells of the immune system, which we call macrophages, and those are found in the what says here the peritoneal, which is in the sort of the gut region, and then also I found them in the actual sciatic nerve as well, plus in the spleen. So as I say, that this is kind of evidence to suggest that the rebalancing can happen by the chemicals. When it's released, it binds to these cells and it gets metabolized within the cells, plus it causes the changes to take place on these different cell types. But in 2021, there was very significant research that came out that has generated another evidence for another way in which this rebalancing can happen. It was via a major breakthrough in migraine research. And what was happening was Professor Peter Goadsby was building on some initial research back in 1979 to look at the idea of creating a new treatment with the industry that would work to treat migraine. So it was very interesting that there's been this association between CGRP and migraine was developing. Now, the initial research was uncovered by Michael Moscovich. He uncovered this connection between CGRP and migraines, and it was an association between the migraines and the trigeminal nerve. Now, that's the nerve that goes from the face to an area of the brain called the meninges, which is connected with that area also in the head where you feel the migraine pain. Now, migraine episodes were found to be associated when the CGRP were getting released from trigeminal nerve fibers, triggering the dilation of blood vessels in that meninges area. So just to show you that again, CGRP is binding on to the receptors and then it gets metabolized in. But what is this second way that we're referring to? Well, it is the fact that the manufactured treatment for migraine is an antibody. That means that this second way was involved in engaging the immune system in some way. Well, what they did was they created this antibody, and then that antibody goes into the system. It finds the molecule, the CGRP, and it also therefore binds it and removes it from the system. Now, the fact that this molecule, antibody, was preventing migraines was indicating that the CGRP, by being removed, was therefore is not available for it to then be binding onto tissues involved in the migraine attack. And this is showing it here, whereby the antibody goes in and it binds the CGRP, or in some cases they've now discovered that there's an antibody that can bind to the receptor, the docking station for that CGRP, and then that also stops. How does this research then connect the rebalancing of a person's emotional health to wellness? Obviously we're touching there a bit on illness, migraine, but we'll come on to that. It's through lived and living experiences with a dental bite plate, which was quite interesting because it was very much a personal experience, a personal connection, and it's all to do with the prevention of teeth grinding and bruxism, because that's what the dental bite plate is used for. Bruxism is something which is commonly associated with stress, anxiety, anger, frustration, PTSD, post-traumatic stress disorder, and antidepressant usage. These are just some of them, and it helps to prevent it by putting so what I mean is the bite plate goes in to prevent the teeth grinding connected with these areas. But the anatomical and the physical relevance of the dental bite plate is the trigeminal nerve. It sits in that area of the bite plate, and it's there also in connection with the fact that when your jaw is being clenched and tightened, or whatever you're doing to do something with that jaw area, it's triggering the trigeminal nerve. And the trigeminal nerve is the evidence also to connect rebalancing of emotional health to wellness. I shall explain. As we said, there's this association between migraine and the trigeminal nerve. But there's now this connection between PTSD, lived and living experiences, with tooth grinding. And it happened to be that my father-in-law was a dentist, and he also, we believe, may have experienced PTSD, but he also created bite plates for his whole family. So it was really interesting that this all happened, and this understanding of the role of the bite plate came just through conversations. But looking into PTSD, it's connected with migraines. Here's some facts of the American Headache Society. Now, that's based on research, which is referenced there, and other research evidence to connect PTSD with emotional health status through papers like this, The Effect of Parental Emotional Abuse on the Severity and Treatment of PTSD Symptoms in Children and Adolescents. So there's that paper. Then there's research evidence to connect emotional health status with migraine. One paper here talking about it in terms of young adults, and two more papers about it in relation to ACEs and migraine as well. Now, there's clearly a connection also through in terms of emotional issues and a dysregulation of emotions going on as well. And so what we're saying here is that how emotional health can become unbalanced, and that is through trauma or acquired mind injuries, as I call them, or an acquired mind injury. And here's a paper that really talks about emotional regulation in connection with PTSD in trauma-exposed individuals. Now, how can this all start to happen in terms of behaviours? Well, this probably highlights a few behaviours, which is what we tend to call emotional suppression, the hiding of an emotion, or the covering it up with a brave face. But when that happens, the mind of a person becoming less receptive to experience an emotion that involves chemicals like CGRP can be a body that starts to reduce the receptors on cells involved in that emotion, because that emotion, if not wanted, the mind is strong enough to be able to make physical changes. But what about the receptors that are expressed on those body cells not contributing to the emotional response, i.e., for example, the cells of the immune system? Well, there's been so much research done that's been looking at CGRP because of this connection into migraines, etc. And they have very recently explored and discovered that microglia cells are those cells like macrophages, immune cells that are in the brain. They have the CGRP receptors, and when CGRP binds to them, it appears that that's what's involved in the migraines as well. And also they find the CGRP binds to mast cells. And some of you will know, obviously, that mast cells are a key cell of the immune system, and they release histamine. And histamine is a very potent substance, which many of you will know is associated with various allergies, including hay fever, etc. So CGRP is binding receptors that are still visible because, remember, CGRP levels must be rebalanced due to really a force of nature, which is one of Newton's third laws. So the research evidence is connecting the neuroimmunology of unbalanced emotional health to mental and physical illness through this CGRP molecule, because of the fact that it's binding these cells and it's triggering these changes in response, and the need for the homeostasis to go back. But also, most I think very important, it also is research to look at the other side. It actually is about showing the fact that rebalancing emotional health connects to wellness because, again, of the CGRP antibody and what that did to remove it. So what I'm going to do now in the next part of this talk is going to relate all this science to bringing it back to Parkinson's. So again, I look forward to sharing that third and final part of this series shortly. It may be available for you to watch when you've finished this particular session, but yeah, it'll be up on YouTube. So I look forward to seeing you in the third and final part of this talk.